What if your kidneys had already lost more than half their function and you felt completely normal? That's not a scare tactic. That's exactly how chronic kidney disease works. According to the Cleveland Clinic, many people don't experience any symptoms until their kidney function has dropped significantly. Often, not until 70 to 85% of function is already gone. That's exactly why millions of Americans are walking around with kidney disease and have no idea. Hello, I'm Dr. Thomas Winslow, and welcome back to the channel. Today we're talking about an organ most people never think about until something goes wrong: your kidneys. And here's a number that might surprise you. More than 37 million Americans are living with kidney disease right now, and according to the National Kidney Foundation, most of them have no idea. Not because doctors are hiding anything, but because your kidneys are quiet by nature. They can lose a significant amount of function before you ever feel a single symptom. That's exactly why kidney disease has earned the nickname the silent epidemic. In this video, I'm going to walk you through 7 early signs that your kidneys may be struggling. Signs that are easy to dismiss as simply getting older, being tired, or having a rough week. By the end, you'll know exactly what to watch for, and more importantly, what to do about it. So stay with me, because sign number 4 is one that almost nobody connects to kidney health. Be the most overlooked one on this entire list. And the very last sign on today's list is one that far too many people wait far too long to get checked. So don't click away before we get there. Before we get into the signs themselves, let's quickly understand why this matters so much, especially if you're over 60. Your kidneys are 2 fist-sized organs that work filtering waste, balancing your fluids, and helping regulate your blood pressure. As we age, kidney function naturally declines somewhat, but for many older adults, that decline speeds up due to conditions like diabetes, high blood pressure, and heart disease. In fact, research from Johns Hopkins University found that more than half of seniors over the age of 75 have a degree of kidney disease. That's why the National Kidney Foundation specifically recommends that everyone over 60 get an annual screening, just 2 simple tests, a blood test and a urine test. Keep that in mind as we go through today's signs, because recognizing these symptoms early is exactly what allows you and your doctor to catch problems before they become serious. Number 1 is persistent fatigue. Now, everyone feels tired sometimes, especially as we get older, so this one is easy to brush off. But there's a difference between normal tiredness and kidney-related fatigue. When your kidneys aren't filtering properly, waste products and toxins build up in your bloodstream instead of being removed. This buildup can leave you feeling drained and mentally foggy, even after a full night's sleep. Research published in the American Journal of Kidney Diseases found that fatigue affects more than 70% of chronic kidney disease patients, often showing up years before an actual diagnosis. The key difference to watch for is this: normal tiredness usually improves with rest. Kidney-related fatigue tends to matter how much you sleep. If you find yourself constantly exhausted for no clear reason, that's worth mentioning at your next appointment. Sign number 2 is changes in urination. This is one of the most direct signals your kidneys can send you, because urination is literally their job. According to the National Kidney Foundation, changes in how often you urinate, how much produce, or what it looks like, are among the earliest detectable signs of kidney trouble. This might mean needing to urinate more frequently, especially at night, or noticing less output than usual. It might also mean your urine appears foamy. A little bit of foam now and then is normal, especially if you're urinating quickly. But if you consistently notice foam that looks like beaten egg whites or the froth on a cappuccino, that can indicate protein leaking into your urine, which is one of the clearest early markers of kidney damage. Any persistent change in your urination pattern lasting more than a week is worth having checked. Sign number 3 is swelling, particularly in your ankles, feet, or around your eyes. Quick question before we continue. How many times do you typically wake up at night to urinate? 0, 1, 2, or 3 or more? Drop your answer in the comments. I read every one of them, and it actually helps me understand what to cover in future videos. When your kidneys aren't filtering properly, they can struggle to remove excess sodium from your body, and that excess sodium causes your body to retain fluid. This often shows up first thing in the morning as puffiness around your eyes, or later in the day as swelling in your lower legs and feet, sometimes called edema. Now, I want to be careful here, because swelling in the legs can also be caused by other things entirely, like heart conditions, vein problems, or simply standing for long periods. That's exactly why this is easy to dismiss. But if you're noticing new or worsening swelling, especially alongside any of the other signs we're covering today, it's a pattern worth bringing to your doctor's attention. Sign number 4, and this is the one I mentioned at the start. If you've ever blamed dry, itchy skin on simply getting older, don't skip the next 60 seconds. This is persistent, doesn't respond to lotion. Most people never think to connect itchy skin with their kidneys. But when kidney function declines, waste products that would normally be filtered out can build up in the blood and irritate nerve endings under the skin. This creates an itch that feels different from ordinary dry skin. It's deeper, more persistent, and moisturizer simply doesn't touch it. Kidney Foundation's clinical guidelines specifically list this as a commonly overlooked warning sign, often not connected to kidney health until much later stages. If you've been dealing with unexplained itching that no cream seems to fix, this is worth mentioning to your doctor, particularly if it's paired with any other symptoms on this list. Sign number 5 is especially in your legs at night. Your kidneys play a major role in balancing electrolytes in your body, minerals like calcium, phosphorus, and potassium that your muscles and nerves depend on to function properly. When kidney function drops, these electrolyte levels can become imbalanced, and one common result is muscle cramps, particularly in the calves, often striking and disrupting sleep. Again, this symptom has plenty of other possible causes: dehydration, certain medications, or simply aging muscles. But if you're experiencing frequent unexplained cramping, it's a piece of the puzzle worth mentioning alongside anything else you've been noticing. Sign number 6 is a change in appetite, particularly a metallic taste in your mouth or a reduced desire to eat, especially foods like meat. When toxins build up in the bloodstream due to reduced kidney function, they can actually affect your sense of taste and your appetite. Some people describe it as food simply tasting different, or a persistent metallic or ammonia-like taste that doesn't go away. This can lead to unintentional weight loss over time, which is often mistakenly attributed to normal aging rather than investigated as a possible kidney issue. And sign number 7, the one the National Kidney Foundation considers particularly important to never ignore, is blood in your urine, medically known as hematuria. This can range from urine that looks pink or red to blood that's only detectable through a lab test. When the filters inside your kidneys become damaged, they can allow red blood cells to leak into your urine instead of keeping them in your bloodstream where they belong. Now, I do want to be clear. Blood in the urine can also be caused by other things, including urinary tract infections, kidney stones, or even intense exercise, so it doesn't automatically mean kidney disease. But it is a symptom that should always be evaluated by a doctor, never one to wait out or assume will resolve on its own. So let's bring this all together. Persistent fatigue, changes in urination, swelling in your legs or around your eyes, deep unexplained itching, muscle cramping, changes in appetite or taste, and blood in your urine. Individually, any one of these could easily be explained by something else entirely, and that's exactly why kidney disease is so often missed. It rarely announces itself with one dramatic symptom. Instead, it tends to whisper through a combination of small, easy-to-dismiss changes that build up slowly over months or even years. Here's what I want you to take away from this video. You don't need to panic over any single symptom on this list. But if you're noticing 2 or more of these signs together, especially if you're over 60, or if you have risk factors like diabetes, high blood pressure, or a family history of kidney disease, that's your signal to talk to your doctor and ask for a simple kidney function screening. It's just 2 tests, a blood test that measures something called your e.g. doctor how well your kidneys are filtering, and a urine test that checks for protein. Both are quick, painless, and can catch problems years before symptoms become severe enough to cause real damage. The most important thing to understand about kidney disease is this: when it's caught early, There's a tremendous amount you and your doctor can do to slow it down or even from progressing further. That might mean better blood pressure control, better blood sugar management if you have diabetes, adjusting certain medications, or simple lifestyle changes like reducing salt intake and staying well hydrated. But none of that is possible if the problem isn't caught in the first place, which is exactly why the National Kidney Foundation recommends everyone over the age of 60 get screened annually, even if you feel completely fine. If this video helped you understand your kidneys a little better, do me a favor and hit that like button. It genuinely helps this channel reach more people who need this information. And if you're not subscribed yet, go ahead and hit that subscribe button with the notification bell. Because we break down real, research-backed health topics just like this one, the kind of information that actually helps you take better care of yourself as you age. I'd love to know in the comments, were any of these 7 signs new to you? Which one surprised you the most? Let me know, and while you're there, feel free to share your age or where you're watching from. I always love seeing how many different places this channel reaches. Take care of yourselves. Listen to what your body is telling you. Remember, your kidneys rarely scream for help. They whisper. The sooner you learn to listen, the longer they'll keep protecting you. I'll see you in the next one.